Hello, everyone. This is Jenner Staves, the new school nurse here at Fall Creek, and I just wanted to give you some up-to-date information about coming back to school during the time of COVID-19. So just some background information and then the county recommendations, as well as just some information on how to care for yourself during this time. So the COVID-19 is a coronavirus, and the coronavirus is a virus that causes the common cold. Most people have had a coronavirus sometime throughout their life. It's named after the crown-like appearance of the molecule. There's a picture there for you. Coronavirus simply means that type of molecule that is the virus causing the illness. Now, COVID-19 is a new coronavirus. It was discovered in December of 2019, hence the name COVID coronavirus disease 19. It was discovered, and the reason that it is such a significant problem is because the human race has not seen this particular virus. Most viruses that we see, flu viruses, coronaviruses, things of that nature, we've been exposed to something very similar throughout our life. And so we're able to fight that off more easily. This specific molecule we have not had before. So that is what is causing such a difficult time with treating it and with coming up with a vaccination. The symptoms, as you all know at this point, are cough, fever, and shortness of breath. Now, the mode of transportation for this virus is respiratory droplets. That's the main way that it is transmitted in the community. So, as you can see from the little picture there, small droplets come out of our mouth every time that we talk, cough, sneeze, all of that. Within 2 meters or 6 feet, most of the droplets have fallen all the way to the ground or somewhere in front of us and not into other people's faces, mouths, nose, eyes, things of that nature. This is the reason that we have started using the masks. They keep the respiratory droplets from going even that 6 feet. So with a combination of masks and social distancing, you're much less likely to transmit the virus. So the general steps to increase safety at this time is keep that 6 feet of distance from others, wash your hands frequently, monitor for any of those COVID-19 symptoms, wear the face covering so you're not aerosolizing droplets throughout the community. Cover your coughs and sneezes with your tissue or your elbow if you don't have a tissue. Stay home when you're sick and clean and disinfect frequently. Now, face coverings, there's a few different kinds. There's the cloth kind, which is what we are all wearing in the community. It's once again to protect from those respiratory droplets from coming from you to the person next to you. They should be worn by the general public, including the staff and students here. They should completely cover the nose, mouth, and chin. Having a mask that is below your nose does not help the situation at all. And it should fit snugly but comfortably against the sides of your face. There's an N95 mask, and this provides the protection to the wearer through enhanced filtration. It does not filter the droplets coming out of the mouth and nose, only going in. And generally, these are reserved for healthcare workers who are working in very close proximity with people with airborne diseases such as COVID and tuberculosis. Face shields, you've probably seen some, and they cover the entire face with a thin sheet of plastic, and they should not be used in place of a actual face covering, but they can be used in addition to, especially if you're going to be working closely with someone who is coughing or sneezing or has some of the symptoms, they need to make sure they wrap around the side of the face and below the chin if you're going to be using those. Once again, they're in addition to face mask, not instead of. So when a student becomes sick at school with COVID-related symptoms, it's best to assess the symptoms and then monitor the sick patient. If a staff person who's wearing a cloth face covering and eye protection, such as that face shield, should monitor the student in an isolation area from a distance of at least 6 feet. If the child is doing okay, it is okay to watch from outside of the room, but you do want to keep a very close eye on that student. And so when the student needs to go home, and we'll go over a couple of the reasons why they would need to go home, it is important that we contact the parent and guardian to pick the student up as soon as possible. Share with them some COVID-19 testing information as appropriate, which we are coming up with a document that we'll hand to the parents so they have the community resources out there. And if at all possible, the parent or guardian should avoid entering the building. If the staff person should take the child to the door and meet at the door. So when somebody in the school or in the community, but specifically in the school, tests positive for COVID, the Eau Claire City County Health Department will notify the school. They do an investigation and they will do contact tracing. That is not the school's responsibility, but we will be helpful in that. The county and school officials will develop a communication plan for that student's class and the rest of the school to let them know if there is a positive case. The county health department will continue to monitor those students that are positive and their close contacts as well. The definition of close contact is being within 6 feet of a physical distance for more than 15 minutes in a day, even if masks are worn the whole time. That is key. It's okay to be within 6 feet of people for very short moments, but once you start getting into long periods of time, then you do become a close contact. So when you're able to determine a list of individuals that were in close contact 2 days before the symptoms started, if you are able to, was that individual a close contact, closer than 6 feet for a total of 15 minutes, or did they have direct physical contact with that patient? If they are, the individuals who are close contact need to quarantine at home and cannot come to school for 14 days since the last exposure and need to closely monitor their symptoms. If they are not a close contact, the individual can continue to come to school. If we are not able to determine who is close contact within like a classroom, as an example, any person in that class with cannot come to school for 14 days since the last exposure. This is why we're trying to work in smaller groups within the classroom. So if one person does become positive, the whole classroom doesn't have to go for the time. So hopefully we're able to cohort a little bit more. So what are the symptoms that excludes a student or staff from coming to school? Any of the symptoms of cough, shortness of breath, difficulty breathing, loss of taste or smell, or 2 of the following: fever, chills or rigor, muscle aches, headaches, sore throat, congestion or runny nose, nausea and vomiting, and diarrhea. And these are if that is not the student's baseline. If the student has a baseline runny nose because of allergies or some other known health situation, then that is an understanding that that is their baseline, but anything above their baseline needs to be addressed. So if they answer those screening questions, the student or staff must stay home, and COVID testing is recommended. Also, household contacts must stay home as well. So if there is someone has say a cough and a fever, so they get tested and it's a negative test, they can return to school 24 hours after they're fever-free without Tylenol or ibuprofen or something like that. And the household members can return immediately. If no test is done, the staff or student needs to stay home for 10 days since the first symptoms began and be fever-free for 24 hours and actually being showing signs of symptom improvement. And if no test is done, the household members that are in close contact with that, in close contacts with that family, with that patient, must be quarantined for 14 days. That is very important to remember that even if the person has a negative COVID-19 during that 14 days, if they're in contact with someone who is positive, they need to quarantine for 14 days. And they, if they do go to the doctor and say they have strep throat or some other alternate diagnosis from a medical provider, then that is something that once that is addressed, they will be able to return to school. If there is a positive test, that students or staff would stay home for at least 10 days since the first symptoms and until the fever is gone and they're showing improvements of their symptoms. Once again, the household members need to stay home quarantined for 14 days, even if that person has that negative test. Contact tracing will be, of all close contacts, will be done by the county at that point. So after having a positive COVID-19 test and then feeling better, the positive individual will need to be isolated for at least 10 days. Isolation is for the person who has the virus, and it's from the time that symptoms began. Close contacts need to be quarantined for 14 days, so a little longer than the actual positive individual. It's because 14 days is the length of time that symptoms can start showing. But a contact of a contact, there's no restrictions. So if someone has a positive test and they have a close contact and that close contact is quarantined, someone who is with that close contact can go about their days as normal. So the ways to stay healthy in a pandemic are specifically proper hand washing. That is one of the most important things that can be done for the health and well-being of everybody, is to properly wash your hands. And there's a list of, the steps to properly wash your hands. You want to do it for at least 20 seconds. The other things that you can do are cover your coughs and sneezes and stay as healthy as you can. Eat healthy foods, foods that are rich in vitamins, vitamin C, B, zinc, things of that nature. Stay active, even as the weather cools off. Find ways to stay active because that will boost your immune system. Make sure you cover your coughs and sneezes, socially distance, wear face coverings, and most importantly, keep a positive attitude because that is going to really help with your overall state of mind. So there are some resources here just for mental health for educators during this time. This is a high anxiety time for the students and also for the educators. So it's very important that you take the time to take care of yourself so you're able to be there for your families and the students. And once again, my name is Jenner Staves. I'm the school nurse here. My email is there and my office extension. I'm on campus one day a week, and I look forward to meeting everybody. Thank you.